Hi, my name is Dr. Megan Crute, and I am a board-certified dermatologist with CallonDoc. Today I wanted to go over some basic information about psoriasis. So psoriasis is a rash that can affect about 2 to 3% of the general population. With that, about a third of those patients will actually start to have issues with psoriasis in childhood. The other 2/3 typically will show up in adulthood. Now, psoriasis has a lot of different factors that can play into it. There typically is a genetic component, so we not infrequently find that people who develop psoriasis have a family history of psoriasis, but that is not a requirement. But there are other things that can factor into it. There are sometimes different environmental triggers, specifically certain illnesses can trigger it in people, different medications, as well as things like stress, smoking, things like that can actually trigger it in some people, but also make it worse in other people who are already prone to it. Now, for people who have skin psoriasis, there's always a possibility that they could develop arthritis that goes along with their psoriasis, and that's called psoriatic arthritis. Now, that happens anywhere between 10 to 25% of people with psoriasis and is more common the more severe the skin psoriasis is, but we can actually see people who have psoriatic arthritis without actually having skin psoriasis. So sometimes that can be kind of a complicated picture. Now, when we talk about psoriasis, most people think of it in the classic version, which we call plaque psoriasis. And the most common areas we see that rash are the outsides of the elbows and knees, sometimes the lower abdomen around the belly button, sometimes the lower back, just at the top area of the lower back there. But psoriasis can have different subtypes. So normal plaque psoriasis, where you get these intensely red, scaly patches and plaques, those can really show up anywhere on the skin, even though the elbows and knees and a few other areas are most common. Now, we can have a subtype called inverse psoriasis, where that typically affects the body folds. So underarms, inner thighs, groin area even. And those tend to have more red or pink areas that aren't necessarily as thickly scaling and can sometimes be confused for other rashes because it can look very similar. We can also see a subtype called Guttate Psoriasis, which is a lot of little tiny spots of psoriasis, and that most commonly we see after it's triggered from an infection. We can also see psoriasis that affects the whole body, where overall patients are just very red and scaly, and it can be a difficult thing to try to figure out what exactly might be causing that. And then there are other special locations that we can see affected by psoriasis. So the scalp tends to be commonly affected and can be somewhat difficult to treat just because it's hard to put medications on the scalp. Nails can also be affected. We can see certain changes in the nails where they can get thicker or start to separate from the underlying skin or have a few different patterns of changes to the nails that we can see. So there's a lot of different expressions of psoriasis, and sometimes we can see multiple different versions of it in the same patient. So it's always helpful to get an evaluation by a board-certified dermatologist if you think you may have psoriasis or know you have it but are having some changes or difficulty managing it. Now, psoriasis in general not only causes inflammation in the skin, but it can also cause internal inflammation. And we get more concerned about the amount of inflammation going on for patients when we see that 10% of their skin or more tends to be affected with psoriasis. Now, this overall inflammation can increase your risk for other health conditions. We can see the risk for diabetes, heart disease, obesity, and mental health issues such as depression and anxiety go much higher in patients with psoriasis, especially as the severity of their psoriasis goes up. And this is because of the general inflammation that we see. So not only is it important for us to address your skin issues, but it's important for us to treat you adequately so that we can reduce your risk for these other health issues in the long run. So as far as treatments, thankfully we're living in a time when we have a lot of availability in terms of what treatments we can use to help treat psoriasis. Now, people with mild psoriasis or just a few areas, a lot of times we can manage with topical medicines, whether they're steroid-based or non-steroid-based. Sometimes we can do local injections to areas of psoriasis if they're stubborn. But as things progress and get more severe, or if there are any tricky areas or subtypes to treat, so if your nails are involved, if your joints are having arthritis issues, or if you have a lot of skin involvement, a lot of times we start to think about more what we call systemic treatments, so treating the issue from the inside. And there are several pills that we can use to treat psoriasis, and we have a lot of different injectable medicines now that can be used to treat psoriasis. They all come along with their specific risks and benefits, so it's always a great conversation to have with your dermatologist about what might be best for treating your condition. But in today's day and age, I think the expectation should be that we should be able to do a pretty good job of getting your psoriasis under control. And we can't promise that we can completely clear every single patient, and we unfortunately do not have a cure for psoriasis, but we have such great treatments nowadays that we expect to be able to get patients 90 to 100% clear a vast majority of the time, depending on what treatment options they're able to have and willing to undergo. So that's kind of psoriasis in a nutshell. It's a common rash that we see, so don't hesitate to reach out to a board-certified dermatologist for evaluation if you think you have psoriasis, or if you know you have it and it's just not being adequately controlled, because thankfully we have lots of treatment options we can go over and hope to get your skin as clear as we possibly can. Thank you.